In Anatomy and Physiology 2, the heart chapter begins with heart anatomy. It then goes through the physiology of the heart in the cardiac cycle. And then there is one final topic on cardiac output. And so this video is going to summarize a couple of the other videos that I have on cardiac output. Cardiac output simply asks the question, how much blood is the heart pumping, say, in a minute? Now, we just have to do a definition, because obviously there's two halves of the heart. And we have to ask, are we talking about the whole heart, about half the heart? Do we divide by 2 or whatever? And it turns out that the amount of blood that leaves your left ventricle in a minute is about the same as what leaves the right ventricle in a minute. And obviously this has to be the case, because if one of your ventricles was working harder than another, then somewhere in your body there would be a pool of blood that was essentially waiting in line for its turn. And so every time that blood is ejected from the heart, the left ventricle pumps about 70 milliliters of blood, and the right ventricle pumps about 70 milliliters of blood. Now, this could vary from heartbeat to heartbeat, but it averages out to be the same. So therefore, when we talk about the cardiac output, we're just going to say it's the amount of blood that leaves one ventricle in a minute. That way we're not trying to focus on 2 dividing by 2. And they do about the same amount of work, so it wouldn't matter which one we picked. Also, I just think it's significant here, because obviously we're going to be talking about the respiratory system soon, that the amount of blood that the left ventricle is pumping to the whole body, to the brain and back, to the arm and back, to the hand and back, to the digestive system, the leg, etc., is about 70 milliliters of blood per heartbeat. The amount of blood that leaves the right ventricle is 70 milliliters of blood, the same amount. The lungs get as much blood as the rest of the body combined. So when we talk about the blood supply in the lung, once again, it's significant. The blood is getting 70 milliliters, the lungs are getting 70 milliliters of blood per heartbeat, which is the rest as the same amount as the rest of the body combined. So that is significant. So the cardiac output, how do we measure it? Then we'll focus on either of the 2 ventricles. And now we have to multiply 2 numbers together. We have to now multiply the stroke volume. That's the amount of blood which is going to be ejected from a ventricle in 1 heartbeat. And then the question then is, well, then how many heartbeats are there in a minute? And so we get this value, the cardiac output, by multiplying the stroke volume, the amount of blood ejected from 1 ventricle per heartbeat, by the number of heartbeats. Now, we obviously want to break this down further, because this idea of cardiac output, how does the heart vary how much blood it's pumping to meet your body's needs? This is certainly important. So first, let's look at stroke volume, one of the 2 factors, and then we'll look at heart rate. So once again, the cardiac output is arrived at by multiplying the stroke volume times the heart rate. Each of these can vary. So starting with preload, this is simply then asking the question, how full is a ventricle before it starts to contract? And so how much blood, if my ventricles are about to contract, how much blood is in there? Well, that varies with, this can vary with what is called preload. So the question is, these ventricles, before they contract, how much blood is in them? How full are they? That's what's called their preload. And it turns out sometimes they can have a higher preload, sometimes they can have a lower preload. Now, this could vary from person to person. So for example, let's imagine that there's someone with a slow heart rate. So, their heart beats and beats and beats more, 1 second or even slightly more than a second goes by. Well, that's a lot of time for the ventricles to fill. If someone has a very rapid heartbeat, now there isn't as much time to fill. So how much time you give your heart to fill. This is certainly one of the factors involved. And then other things can as well. So for example, if I lie down for a little bit and I stand up quickly, one of the things I'll notice is, I get lightheaded. And that's because when I stood suddenly, I took my body by surprise. My blood is in my feet. I wasn't effectively moving it, to fight gravity. And so therefore, if my blood is in my feet, then at that minute, at that instant, there's less blood reaching the heart than less blood coming out. Exercise and epinephrine and stress can change this as well. It changes blood pressure. So how much blood was in these chambers? So these chambers could have been more full or less full. So once again, this could be comparing two people. So the person with a very rapid heartbeat, their ventricles are always going to be less full. The person with the slower heartbeat, they're always going to be more full. Or this could change if I start to exercise and blood pressure increases. If I stand suddenly, then one of these could be, suddenly if there's less blood coming back from the veins, now my right ventricle would be less full. So the lesser the preload, the lower the stroke volume. So in essence, if a chamber has less blood in it before it starts to contract, then there will be less blood that leaves it in the contraction, right? So one of the variables for stroke volume is preload. Let me just do this for a second because the internet was slow. So once again, here's our question. What determines cardiac output? Well, we multiply two numbers together to get our cardiac output, our stroke volume and our heart rate. And it turns out stroke volume is controlled by three things. First, the preload, right, in which we can ask ourselves, how full is a chamber before the ventricle starts to contract? So here's a chamber that's fuller, here's a chamber that's more empty. Maybe I stood suddenly and less blood was coming back through the vena cava to reach the right atrium into the right ventricle. And so a chamber which has less blood in it will eject less blood in that heartbeat. A chamber which has more blood in it will eject more blood. So stroke volume affects, preload affects stroke volume. And then the question of contractibility. I know with my biceps brachii, I can contract it with great force to lift something heavy, or I could contract it with a little force to lift something not as heavy. So the same muscle, I can then have it contract to a greater or lesser degree. And the same thing here with the myocardium. I could have it contract a little bit, in which case a little blood comes out. I can have it contract harder, in which case more blood comes out. And so this is muscle. Its degree of contraction can vary. And so therefore, there are things which affect contractibility. So for example, when the autonomic nervous system is engaged, so when I'm doing the fight or flight response, I'm releasing epinephrine, then that's going to cause more contractibility and a higher stroke volume. Calcium, we know calcium comes in causing that plateau. When there's higher calcium, that then increases contractibility and thus increases stroke volume. We can decrease contractibility by inhibiting the fight or flight response, having the parasympathetic division. Acidosis, increased potassium levels. These things can lower contractibility. The third and final thing which affects stroke volume, so once again, cardiac output is controlled by two variables, stroke volume and heart rate. And then stroke volume can be controlled through three things. Preload, how full the chamber is before it starts to contract. Contractibility, how hard the muscle squeezes. And then finally, something known as afterload. So afterload refers to how much blood is left over after the systole is done. So, the ventricle squeezes, and then you're assuming, well, it squeezes out all the blood, right? And the answer is no, because we have that ESV, that end systolic volume. Not every drop of blood leaves the ventricles during systole. So here I have two individuals being compared, and I'm sorry that the focus isn't perfect, just come on. And so I'm comparing now two individuals. One has high blood pressure and the other doesn't. And so the question is, we're going to go back. So let's say both of them start their heart beat now. This individual, and I'm sorry that the focus hasn't kicked in yet, but here we have high blood pressure. So there's a higher than normal pressure in the aorta and the pulmonary trunk. Here's a normal individual. So their ventricles start to squeeze in the S, and they squeeze and squeeze and squeeze. And these semilunar valves will open, and we will eject blood when the pressure in the ventricles exceeds the pressure in the vessels. But the person on the right has a higher pressure in the vessels. So notice that the person on the left is ejecting blood. So there is blood in the person on the left, which is leaving the ventricles and being ejected into the vessels, but on the person on the right, no, because the ventricles have to squeeze and squeeze until the pressure here exceeds the pressure that was in the vessels. If the pressure in the vessels is higher because someone has high blood pressure, then it's going to take another split second. And so this person on the left has more time to eject blood than the person on the right. On the right, the semilunar valves close when the pressure in the vessel is higher than the pressure in the ventricles. And so once again, that will happen a split second earlier for the person on the right. So this person on the right has a higher blood pressure. And as a result, they had less time to eject blood. The semilunar valves opened a split second later and closed a split second earlier. And because of that less time, then they have more blood left over afterwards, which is called their afterload. So this person has a higher afterload because of their high blood pressure. Okay. And so how much blood is going to be ejected from the heart in one heartbeat? That's what's called the stroke volume. And it turns out that varies based on preload. And the preload is how full the chamber is before it starts to contract. Contractibility, how hard it squeezes. And then afterload, because of high blood pressure, how much blood would be left over afterwards. All right, so stroke volume can be varied. But so too can heart rate, all right? And so heart rate can be varied. So it varies from one person to another. So an athletic person might have a resting heart rate of 60 or under. Someone who's, the average heart rate in America is 75 beats per minute. But if you're out of shape, then it could be higher. But then obviously we can vary it, say during exercise, it's higher, and at rest, it's lower. And so the heart rate can vary because we have nerves which go to the SA and AV nodes. They are called cardiac acceleratory nerves. While it is the SA and AV nodes which are deciding when a heartbeat should begin, they are autorhythmic. They are the SA node is the primary pacemaker. Nevertheless, the nervous system can encourage the SA node to beat faster. All right, so while the SA node is establishing the heart's rhythm, the nervous system can influence the rate at which the SA node does that. And so there are cardiac acceleratory nerves that can release epinephrine here, and thus this can speed up heart rate. But we also know that in the sympathetic division of the autonomic nervous system, above the kidneys, there are adrenal glands. And from the middle of the adrenal glands, what we call the adrenal medulla, epinephrine can be released as a hormone. So epinephrine can be released as a neurotransmitter here. It can be released as a hormone here. And thus there are two separate ways that during exercise or during an emergency or during stress that we can speed up heart rate, both through cardiac acceleratory nerves directly, and then also through epinephrine being released from a hormone, as a hormone. There are other ways as well. So right before a track meet, you'll notice that people are moving about. They're not just sitting as like, oh, I'm going to run in a minute. Let me relax right now. They're moving because just the fact that we start to move signals proprioceptors, those receptors in our nervous systems that are in, say, tendons and ligaments and joint, capsules, that then tell the brain that our body has started to move. And so our brain will then increase heart rate because exercise is coming. So proprioceptor activity increases heart rate. Increased temperature does as well. So when you have a fever, your heart rate is higher. An animal that is hibernating has a lower heart rate. And then calcium can increase heart rate as well. So this is why calcium is so important. We have those hormones which regulate calcium levels. Calcitonin brings it down when it's too high. Parathormone brings it up when it's too low. Because if your blood calcium levels go up by about 1/3 today, you can die. If your blood calcium levels go down by about 1/3 today, you can die. And we saw that calcium can affect cardiac output 2 different ways. It increases contractibility and it also increases heart rate. So, altering the level of calcium in your blood has significant effects on your heart. Just as there are ways that we can increase heart rate, we can then also decrease heart rate. The other half of the autonomic nervous system, the parasympathetic division, it then sends the vagus nerve to the SA and AV nodes, where it releases acetylcholine, and this will then slow heart rate, encourage the SA node then to have fewer beats per minute. And so the parasympathetic division of the autonomic nervous system can slow heart rate. And so also those other items. So if we don't have proprioceptor activity because we're not moving around so much, if our temperature goes down, if our blood calcium goes down, all of these will decrease heart rate. In my video playlist, some of my videos are sillier than others. But once again, if you're trying to memorize something, there's lots of different ways you can memorize it. And so including, I have a cardiac output song, which, I think, is valuable for my students where, it goes on the different components here. I don't know if you're hearing volume. Oh, well, you were thinking, another way, if a, sorry, maybe. Just checking the volume. Maybe this would help. Now, in the last section, I use words like sympathetic, parasympathetic, epinephrine, and the fight or flight response, the adrenal medulla. So here's the thing. In anatomy and physiology, the autonomic nervous system is typically covered at the end of AMP1. I joke with my students, this is when they've stopped paying attention. They've been stressed out, their brains are full. It's the last day or two of the semester. And so very often they remember very little from that lecture from AMP1. But that's a problem in AMP2 because the autonomic nervous system is what controls the guts. But AMP2 is all about the guts. And so if you don't have a recollection of that short chapter, then it's going to come back to haunt you a bit in each and every chapter in AMP2. So the remainder of this video is very short, a synopsis of the absolute major points of the autonomic nervous system. And so if I get through this and you're thinking, oh, I think I remember a lot of what he said well enough, then you're probably good. However, if you are of the mind as I really didn't understand that at all, you might want to go back and review the autonomic nervous system because, as I said, it controls not only the heart, but the lungs, the digestive tract, the reproductive system, the immune system, etc. And so if you're having trouble with this topic, it'll just hurt you in each and every chapter. So in general, your nervous system can tell skeletal muscle what to do. I can do that. That's what's called your somatic nervous system, your control over skeletal muscle. But my nervous system can control everything else as well. I can control the cardiac muscle of the heart, the smooth muscle of the respiratory, digestive, urinary, reproductive system. It can control exocrine glands, say digestive glands, sweat glands. It can control endocrine glands, which makes hormones. It can also send commands to immune tissue and even adipose. So then there's all of this other stuff that's not skeletal muscle. And your nervous system has a branch which controls this stuff. It's what's called the autonomic nervous system. So the autonomic nervous system is the part of your nervous system which controls everything other than skeletal muscle. Let's just say the guts. Now, your guts have to be on the same page. So for example, if you're walking along and you see this lion, that's a problem. And your response to this lion may determine your life in the next 10 minutes. And so therefore you want your heart to beat faster, all right? However, if your lungs aren't in on this, what good is your heart beating faster? Because what you need your lungs to do is to undergo bronchodilation so that more oxygen comes in. That way, when the heart is beating, it's beating oxygenated blood. All right, if you're not getting enough oxygen, your heart beating faster, well, it's not as adaptive as it should have been. So let's say now your heart and your lungs know your respiratory passageways dilate, your heart is beating faster, great. But now let's say your blood vessels send this oxygenated blood to your spleen. What good is that going to do? It's not. You don't want blood to go to your spleen in an emergency. You want it to go to your leg muscles so you can run. You want to sweat so that you can cool off as you run. So the guts have to be on the same page. All right, you can't have the heart knowing it's an emergency and the lungs don't. All right, if it's an emergency, everyone has to know, so everyone acts as you should. You can't have half the body doing this thing that you do during an emergency and then half the body doing something else that you do when you're at rest. And so the autonomic nervous system, which controls the guts, it has these two modes. There's a sympathetic division that controls the fight or flight mode. We use it during emergencies, we use it during exercise. And then we have a parasympathetic division for the rest and repose mode, right? So we have a sympathetic division, but then when you're at rest, now, there is no lion, and so now we're going to use a different branch. We can see anatomical differences. So for example, the sympathetic division, it's headquartered here in the middle of the spinal cord. Hence, it's called the thoracolumbar division in the thoracic and lumbar sections of the spinal cord, while the parasympathetic division is mostly in the brainstem, but also a little in the sacral division. So it's called the craniosacral division. It's mostly in the brainstem, and the 10th cranial nerve, the vagus nerve, that carries about 80% of parasympathetic fibers. And so we have these two halves of the autonomic nervous system. Now they send out nerves that can touch then their target tissues. But then there's also this one other little trick where the sympathetic neurons, which go to the adrenal glands, then go to the middle of the adrenal glands, what's called the adrenal medulla, where they release epinephrine. Now, epinephrine is a neurotransmitter if it's released at a synapse, where a nerve cell touches another cell. If it's released at a synapse, it's what's called a neurotransmitter. But if you dump it into the blood, now it's affecting cells all over the body, even the cells that nerve cells don't touch. Now it's acting as a hormone. So during an emergency, if you see a big cat on your way home from school, you release epinephrine into your blood, where it then acts as a hormone going all throughout the body. Okay, so there's those anatomical differences. What are the functional differences here? Well, I have a video which goes through all of them. Let me just, so this is just a very, very quick synopsis. So in the sympathetic division, just the one that was next in this video, was clotting. All right, so we can make our blood thicker. We can increase the number of clotting factors. That's a good idea. If you're, see a big cat, or, your odds of bleeding in the near future have gone up. You're going to cause your sweat glands to start releasing sweat. That's a good idea. If you have to run away from a big cat, you may be overheating soon. You're going to tell your heart rate to go up. All right, so the sympathetic division and epinephrine, is both going to reach the SA node through cardiac acceleratory nerves, but also as a hormone. So the heart will beat faster, and also we increase contractibility. So, that will then, stroke volume goes up as well. Our blood pressure overall will go up because we will have vasoconstriction of the smooth muscle and blood vessel linings, and we will change where blood goes. All right, so during an emergency, you're going to send less blood to your digestive, urinary, reproductive, and immune systems, and more blood, say, to your muscle and to your heart. So the sympathetic division affects the cardiovascular system, as does the parasympathetic division. So at rest, your heart rate goes down, your blood pressure goes down, your stroke volume goes down, and you now send blood to your digestive tract, your urinary, reproductive, immune systems, and less to your muscles. During an emergency, our muscles will actually get tense, as we're, preparing now to react, etc. And so I go through the various systems here, and just go through during an emergency. This is what the fight or flight system will do to help you better be able to run or to fight, as opposed to when you're at rest. That's when you're digesting your food, making urine, where your reproductive system is getting most of its blood, where your immune system is being encouraged to fight off flus, and screen blood and lymph for microorganisms, for toxins, for cancer cells, etc. Now, not only is this important in the short term, but then just, one of the things we face in the modern world is stress has changed, but the autonomic nervous system has not. The autonomic nervous system evolved when a big cat was a stress, all right? And so you're going to react, and in 10 minutes, it's going to be over one way or the other. Modern stresses are different. Modern stresses are finals week, or accelerated courses, or a difficult time at work, or a difficult, time, with your relationship. Stress can go on for days, for weeks, for months. Now that's a problem, because the system which deals with stress does what? Well, it makes your blood pressure higher. It makes your heart, beat faster. That's good for 10 minutes, but it's not something you want to do in the long term. You're putting more clotting factors in your blood. That's good if you're about to start bleeding, but as a long-term strategy, now it just means your blood is more likely to clot, and now you're at a higher risk for heart attack and stroke. If you need to start running, well, you need to put glucose into your blood, from your liver. You need to break down fat bodies so there's energy sources available. Well, that's good if you're going to start running, but if you're writing a term paper all day and you're doing this, well, now you're just constantly putting too much sugar into your blood, et cetera. Now you're at risk of diabetes. And if under stress, it makes sense now to send less blood to your immune system, less blood to your digestive system, your reproductive system. But if this is a long-term strategy, when your immune system gets less resources, now you're more likely to get sick. People are often get sick after a very stressful event because they haven't been giving the immune system what it needs during that time. They may have trouble digesting their food because they're not trying. They're sending blood away from the digestive system. They may be less interested in their partner. When they're with their partner, they may be, less, capable of, being with their partner because less blood flow is going to the reproductive system. And so this is a problem if you're using the ancient sympathetic division, which was, meant to deal with short-term stresses like big cats. If you're using it to deal with modern stresses, which last for longer periods of time, and whether it be ourselves or, some of your patients, many of them will then have problems based on using the sympathetic division to deal with modern stresses the way that it was not intended to. One last video I just wanted to mention is something that we don't discuss as much as we should, is it's easy to talk about a synapse where like this nerve cell touches another cell, like a neuromuscular junction. But there are actually, one that looks like this. But there are actually nerve endings which move a bit. All right, and so therefore it's not that they're physically attached to, say, a muscle cell, but we have these moving ends, and so this nerve cell is making neurotransmitter, but it's not just making it to affect one cell. This neurotransmitter is now just kind of going in this general region of the tissue. Now, white blood cells are fascinating. White blood cells can have receptors for neurotransmitters, and then white blood cells can secrete things that then nerve cells have receptors for. So even though this isn't typically what we think of as a synapse, nevertheless, your nervous system is talking to the cells of your immune system, all right? And then your immune system is talking back. And so there, when people talk about the mind-body connection, well, obviously we can interpret that a lot of ways. But one is, obviously, your nervous and immune systems, they're not completely separate. They're communicating with each other. So your state of mind can certainly influence your health and vice versa. They are in communication. So we think of neuroimmune synapse, but we should. Blood cells are around nerve cells, and but they can respond to even adipose can respond. I just want to mention neurotransmitters. Neurons make a variety of neuropeptides, which can influence cells as well. And so once again, the autonomic nervous system is the part of the nervous system which controls the guts. The heart, the lungs, the digestive organs. And even though a typical A&P student studies the autonomic nervous system in A&P 1, nevertheless, the major lessons from that chapter are very relevant in the autonomic in AMP2, and we're constantly using terms like sympathetic versus parasympathetic, epinephrine, etc. So if you have little recollection of that, you might want to review that going forward.